Hi, I'm Dr. Leslie Gray with Dermatology Center of Atlanta, and welcome to Customer Appreciation Week's noon Zoom. So I'm excited to have you here today. I'm particularly excited about this noon Zoom because we are going to be doing a cosmetic consult. This is the first time we've done that, and the lovely Brenda has graciously volunteered to be our model. And we're going to be going through basically some frustrations that bother Brenda, and I think they're pretty common, and how we can use injectables like fillers and neurotoxins like Botox or Dysport to help. So that's what we're going to be doing today. If you're really interested in the deeper dive into fillers and Botox, I do encourage you to watch, and if you weren't around for yesterday's noon Zoom, that's what we talked about. We talked about anti-agings with injectables. The link to that noon Zoom will be in the chat, so if you're interested, head on over there after this noon Zoom. So Brenda, first of all, thank you so much for volunteering to be a model, and tell me kind of what's bothering you, or what are your frustrations?
My frustrations are, I look tired.
Mm-hmm.
My eyes are hollow.
Mm-hmm.
I have wrinkles on my forehead and around, and my jowls are really bad.
It's annoying how that happens, isn't it? So Brenda, if you'll look straight. So first of all, Brenda's beautiful, and I always, when I'm looking at someone and evaluating them, the first thing I tend to do is obviously I want to listen to the complaints, and also kind of in my own head, I'm thinking, is that what I'm seeing too? And what Brenda said is really what a lot of people say, and she was really super specific about pieces of her face, right? She was talking about her eye area, the wrinkles here, this jowl. And I think that's typically how we see ourselves. I mentioned in yesterday's noon Zoom that I had read something recently that I thought was insightful, where that we see ourselves in pieces, everyone else sees us as a whole. I think that's really true. When I look at Brenda, I do see what she's talking about, but I'm kind of trying to look at what's the cause of all this, like what's happening. So I kind of, in my head, when I'm evaluating someone, I break it down into two categories, if you will. I think of the structure and framework of someone's face. So if you look at Brenda, she's got these beautiful cheekbones. She's got actually a pretty nice jawline. Gorgeous eyes. Look at the color of those eyes. They're so pretty, right? And then I look in this triangle, which is like the arch in the middle of the frame. So those pretty eyes are sitting there. That's where the mouth and lips are. So you kind of separate it into the two categories, and we're going to walk through what I'm thinking about through each one. And if you think about it, you can't have a beautiful piece of art and no frame, because then the art's on the floor, and you can't have a great frame and no art because it's empty. So they do work together and they complement each other. Some of the things that Brenda talked about can be addressed with Botox. Some of the things can be addressed with fillers. I do want to go through both. I think I want to start though with the fillers, and then we'll talk about Botox. Brenda's got what's going on. Actually, if you can, Allison, get that photo from the other day where we showed the mother and daughter, and it was the inverted triangle and the regular triangle. If you can get that picture up, that would be great. And okay, so this is kind of what's happening. So Brenda's got these beautiful features, but if you kind of look and see what's happening is the weight or the meat of her face, if you will, is falling forward and it's low. So she's lost volume out through here, this chin area, the temple area. And you can take the picture down. So that's kind of typically what happens. As we grow up, we go from a triangle of youth where we have a tiny chin and chunky cheeks, and we start to square up, and then it starts to fall forward and down. So that's kind of what you're starting to see with Brenda. She had mentioned her eyes, and I think, that stems from this volume loss in a lot of different areas. So in the structure and framework of her face, I'm looking at where is the volume loss. This is her cheekbone, and you look at her jawline. And if you look at the area in between, in particular, it might be hard to see on the camera, but she's got some loss in through here. So I see that. There's loss along the cheekbone. There's actually, her cheeks look full here, but she does have some mid-face volume loss, which is actually impacting the under eye area. And in fact, if I just do this, that's kind of the effect that you have when you start to volume replace some of this loss. Now I want to make the distinction between volume replacement and volume over replacement because volume replacement is natural. This is what you've lost anyway as you're growing up, and that's kind of my goal with fillers, and it's to gradually and kind of thoughtfully volume replace. So we want to kind of do this in a stepwise manner that makes sense because fillers truly are a journey. We're not trying to get Brenda, she had mentioned a lot of different areas. The goal is not to kind of quote unquote fix all this in one setting, but we're going to make it so that every time she gets out of the chair after her injection, she feels better about these spots and that we're going to see gradual progress along the way. Now, Brenda gets to go as fast or as slowly as she wants. As long as she's coming back for fillers about every 4 to 6 months or 2 to 3 times a year, she can make forward movement because these fillers are kind of like stair steps or building blocks. And as long as you come back in that time frame, there's something left. The fillers that we use are all hyaluronic acid based. I don't really want to get into necessarily the nitty gritty of all. I use primarily a lot of Restylane products and Juvederm products such as Voluma, Velour, Volbella, but I don't want to get into the nitty gritty about each one. I will tell you that they each have their individual different properties. So hyaluronic acid is found in our skin naturally. We lose it as we age. So I love that you're replacing like with like. And you do get this collagen building over time, but as each product has their own unique features. So for different things, different problems, I'll use a different product. What's going on with Brenda in the structure and framework, 99.9% of the time, we end up starting there with most people. And I think Brenda would be a case with that. And I would use a product called Voluma. And it would be with a series of like injection points. And a lot of people want to really pin me down on exactly where you're going to inject it. But the way I inject is I start with one spot and a patient will lay back and then they sit up and I look because it's fascinating that just little tiny amounts make a big difference. One syringe is just 1 cc. It's only 1/5 of a teaspoon, but you would be surprised when we put it in a bunch of different areas what it can do. And I get a little OCD about 2 things. One is symmetry. So if you look, Brenda's face is not perfectly symmetric and nobody's is. And I'm not picking on you, Brenda, but it's just, we all are like that. But I do want to see things approach symmetry. You don't want to cram a face into symmetry because even if you could do that, that would make her look fundamentally different, and I definitely don't want to do that. So we just want to make sure things are approaching symmetry. The second thing I get very OCD about is this balance between the upper half and lower half of the face. So like in other words, if we took a picture of Brenda and we cut it off at the nose and we put the 2 pictures side by side and asked a stranger, who's older, like eye lady or lip lady, they should say, I don't know, they're about the same age. So how do we actually treat? So I do want to show you, it's a combination of things. This is just a little syringe of filler. I want to show you guys, first of all, what the filler looks like. So this is Volbella, and I'm just going to open it up and I'm going to put the needle on. Oops, I'm not actually going to treat Brenda today, but I am going to treat her soon. But can you see that, Allison? Okay, and I'm going to squeeze out some of the filler. Can y'all see that? Is that coming out? So hopefully you guys can see that. So it's really kind of like a gel. It's soft. Do you want to feel it?
Yes. Oh,
yes.
Yeah.
So it's made from hyaluronic acid, again, found in our skin naturally. It's also found in a lot of moisturizers. It really loves water, so it kind of really helps to hydrate the skin too, which is a nice little side effect. And when we treat, we use a combination of this tiny needle for certain injection points. Like with Brenda, I probably would start here. Like I mentioned, most people, I do start with Voluma because it has a lot of lift, probably along the jawline. I'd also use a cannula, and I want to show you that too. So what I just showed you is the needle. Cannulas are long, blunt tip, flexible wands. So this isn't sharp. You want to touch that? You can't really.
Oh, yeah.
Yeah, so the opening, and it's actually on the top of this, which I'm sure you can't see because I can barely see it. I don't have my glasses on. But what happens is we can use a needle and that's really for more injection points, right? Or we can take this cannula and put this on, and we would use another tiny, tiny needle And again, I'm not actually going to treat her, but I just want to show you kind of what's involved. And we would put like a tiny injection point, say on, for instance, on her cheek. And then from that one point, you can put the cannula here. And it's a very honestly safe and gentle way to treat someone. So it looks creepy and scary maybe to some of you, but I promise you, this is a really gentle way to approach fillers, where we can kind of treat a bigger, broader area of skin with thin little ribbons of filler. It's also a very safe way to address what Brenda doesn't like, which is the under eye area. We put a little injection point here and then very safely and gently, not go in her eye, but just under it to kind of address the areas that are of concern with her. A lot of times she's got these baby, I mean, not even bad little crow's feet here. A lot of times we'll go perpendicular there to kind of help soften those out. Again, going very slowly, very gently. We use numbing cream prior to the treatment. We also do this funny thing, but when we're treating someone, we tap on them. My medical assistant helps me with that, and it's a great distraction. We also use a lot of ice, and honestly, there's a lot of breaks because I get very particular in each little bit and amount that we're putting in, we're going to stop. I'd have her sit up, we would look together, or I would look and just kind of evaluate and make sure things are kind of evolving in the way that makes sense for her face, because you do have to put things in a certain order too. Again, going back to Brenda's, what's going on with Brenda. The first order of business to kind of address her concerns is to move this weight up and away. So if you do this, you kind of get that feeling. And the way we would do that, again, is with some Voluma. Filling in some of these hollows here does not make her face look whiter or fatter. That happens again with volume overcorrection, but she had volume here. We're just going to put back what was there, and it actually slims the face when you do that. Sometimes I'll go along the jawline too with that cannula to create a better definition of her jaw. So if you turn this way, Brenda, she's got this little bit of jowling here. So if we add a little bit up here, you can see how that picks that up. If we add some here, that'll help. And then if we go with the cannula, that will help further too. And then if you turn forward. So then if we move into her arch part of her face, we look more, instead of volume and lift, I'm looking more for details. And the first thing I always look at when I'm looking at the art part is, number one, where are your vertical lines? Vertical lines bring everybody in and down. Brenda is, I don't know if you can see them, they're pretty subtle, but frown for me, Brenda. She's got these little 11s there. We'll talk about that in a second with Botox, but those are vertical. These are vertical. These are called your nasal labial folds, and then your melolabial folds are here. She complained about these as well. So could you just fill the vertical lines? Yeah, you could, but and a lot of people, when they first come in, that's what they want to do because they're nervous. They're like, just fill those lines. That's all I want to do. But I will point out to you, if we just fill these lines on Brenda, the line itself does look better, but you're adding weight to an area of her face that's already weighty. It's better to lift and pull before you push, and that looks better, it looks more natural. So typically that's why we put it in that order. Again, there is a method to the madness, and there's a logic to the journey. We're not looking, most of my patients are like me, they're very conservative. They don't want this big, huge change, but we want every session to make sense for you so that you're making logical progression. And so a lot of times it is a lot of discussion about what makes sense, what is going to make the biggest impact. What's the neediest part of her face? And so that's what I look at a lot too. So for her, it starts with the lift. Going into the art part, it would be starting to correct for some of the vertical lines. Second thing, after vertical lines, I'll call it micro areas of volume loss within that triangle. So that would be her eye area. That was one of the first things, actually the first thing, right? Yes. You said that bugs you the most.
Yes.
So it's interesting and fascinating, actually doing things with your filler out in the periphery of your face or filling the mid-face volume can help the eye. But sometimes we do need to put some filler directly under the eye. And like I showed you before, we could do that with the cannula very safely, very gently, and very slowly, I'll add too. I would not, Brenda kind of has, I don't know if you could see it, but it's a really distinct almost line right through here. It's like a little shelf, and some people have that. Some people have a fat pad too, like a big bulge before that. you have to be super conservative when you're filling that, I believe, just because if you overfill that area, it can look like one big giant like fat pad or bag, and we don't want that to happen. So sometimes taking your time with this and building it over time, you get a more natural looking result, and I believe a longer lasting result with that. And again, those are things that we talk through as we go in the filler session. Other vertical lines for her, these guys, I want to talk about her chin for a second, because no one thinks about their chin, but it is such an important part of the face, and it really is an area that creates such balance. A lot of times just by filling in some of the deficits in through here, here, and here, and sometimes adding a little bit of volume here. Let me see if I can see it on you, Brenda. Yeah. If you do this and this, turn this way. I don't know if you can appreciate this. And these are subtle changes I'll give you, and probably hard for you to see, but if you do that, this area looks a lot better. So creating a little bit in the chin can help as well. Some people really have significant volume deficits in the chin, and that's where we spend a lot of our time then in those patients. And that's why I think the consult is so important, because it's so individualized as far as what your individual needs are. So for Brenda, again, she basically looks great. She's just got some volume loss in some specific areas, I think, and we can kind of bring her along with fillers nicely. Lastly, I'm going to mention her lips, because sometimes lips and filler in a sentence sometimes terrify people, because I will grant you, there are a lot of bad lips out there. But I think, with Brenda, she's got actually a pretty nice shape to her lips. I look at proportions between the upper lip and lower lip. Technically, your upper lip should be about 2/3 the size of your lower lip. We look again at symmetry. And there's ways that you can approach filling a lip. I tend to not even start with lips until some of the other bigger volume deficit areas are starting to be corrected, because you don't want things to look out of proportion. At the same time, you don't want to be so afraid of doing your lips that you never do them and everything else looks great, and then this area is just falling behind. Remember the picture, cut off at the nose? We don't want the lips to be the things to fall behind. So it's not necessarily, unless someone comes in specifically asking for lip enhancement, which does happen, but even then we start slowly and conservatively. But most patients, it's a conversation that does eventually come up. So I always kind of pre-warn people that if I mention it, it's not because I want to give you lips, it's because I want to have a balance between that upper half of the face and lower half of the face. And sometimes you just want the lips to look softer. There's some specific fillers that I think are beautiful for just creating softness with the lip, without creating a lot of push or volume. So we have different ways that we can approach the lip too. What else? Let's see. We talked about treatments every 4 to 6 months. Sometimes you might go home though and go, oh, I wimped out. I wish I would have done more. So you can always come back as soon as 4 to 6 weeks. I do ask that once you go home, let the filler set. I think it builds on itself, and you actually get a better result if we can kind of just wait a little bit once you go home. But 4 to 6 weeks to 4 to 6 months is kind of your time frame. Okay, so let's switch gears a little bit and talk about the lines that you said bother you here. Remind me, it's the forehead lines for you? These? Yes. Okay, so I want to point out that Brenda's complaining about these horizontal lines here. Remember, horizontal lines are not as impactful as vertical lines, but they bug her, right? And you do see that they're probably a little bit deeper than her frown line, but frown for me. So Botox, its only job is to temporarily relax a muscle. And this, what Brenda has going on up here, I think I would approach with Botox. And the reason too, even though she's complaining about her forehead, that's not where I'm going. I would start with her, because sometimes it's difficult. If you just treat a forehead first without treating the frown, this area a lot of times looks too dynamic and it almost looks like wormy or Romulan-like, I don't know, not pretty. So we want to kind of appreciate the fact that she has a pretty strong frown. So if you look forward, so frown again. She has, this is called a procerus. These are her corrugators. We would treat her frown first. Botox diffuses out around 1 centimeter where you inject. So for free, Brenda gets some of her forehead. So typically a frown is considered an area. This area, the forehead's another, and these forehead lines are caused by this frontalis muscle. That's a big muscle that kind of inserts above your brow, goes all the way into your scalp. And in this case, we just want a little piece of that frontalis, just enough that's making these lines that she doesn't like. Now, we know where the muscles are supposed to be, but we're all put together a little bit differently, and it's impossible for me just to look at her and know where these muscles are inserting. So I think the safest approach is to start low and slow with Botox. So we would just do her frown actually to begin with, even though she's complaining about her forehead. I would bring her back in 2 to 4 weeks for what we call a quick peek, because then I can assess with that Botox that diffused out into her forehead, how much is left up here. So probably not much. Sometimes it's really surprising. Raise your forehead up, Brenda. So when she raises up, you see this line and you think, gosh, if you just treat down here, this is gonna look even worse. Honestly, sometimes that just disappears. I don't know how it works, but that's how someone's put together. So I think you really wanna, again, do it very conservatively. When she comes back, if she still has movement, I'll be able to tell where she's pulling from, and again, try and assess where I can put the least amount of Botox that will give her the effect she wants. One of the things I really look at when I'm treating with Botox is the upper lid. Close your eyes, Brenda, and pretend like you're sleeping. And then open your eyes, but don't move your forehead. So she doesn't have bad lid laxity. It's a little bit worse. I don't know if you can see on this side versus that side. So you want to be really respectful of that. She's not, some people are very heavy lidded, and if you're really got that heavy upper lid, or you're someone who your forehead lines bother you, but your upper lid's quite heavy, it does get dicey, I'll be honest with you. It's not impossible. It's something I would definitely want to evaluate and see, but at all costs, we want to protect this upper brow, because if this gets heavy on Brenda, or anybody, it doesn't look good. So even if your forehead looks perfect, but your brow's heavy, it's not a good look. So we want to be really respectful of that upper brow, and I think the way you can do that is by going very slow and very conservatively with the Botox. And so again, we would start with just a very simple treatment, have her come back in 2 to 4 weeks and go from there. Ideally with Botox, you want to come back probably about every 3 months for the first year, because you want to treat before 70 to 80% of your muscle movement comes back. So we want to keep the muscle weak. In doing that, the skin gets a vacation, so that line on its own a lot of times softens. And then also after that year, a lot of times you'll find you can go longer between your Botox, but I like to give it at least a year first to see. So as you can see, both fillers and Botox become a journey. Botox, I think you get some prevention, because you do prevent the lines that she doesn't like from getting deeper. And the fillers give you the instant gratification, right? So if we do a syringe of, even 1 syringe of filler on Brenda, that would certainly help. And she doesn't need much. You know, that's the other thing. I think people get really nervous about, oh my gosh, if I start with this, I'm just gonna need a ton of stuff. I don't believe that. I mean, I think, you know, it does start with the consult, obviously, but most people can get away with very conservative amounts and still get an impact where they feel better. And, you know, again, it's conversations, it's just teaming up together, so we make sure that what your needs and wants are being met and that you're feeling better after each session. Okay, so running out of time, so I want to ask Brenda, do you have any questions or concerns?
So it lasts 3 to 4 months?
Well, good question. So not necessarily. The Botox, I like to treat you about every 3 months in the beginning, and then you'll start to go longer. For the fillers, these fillers, different fillers last different lengths of time. They can last anywhere from 4 to 6 months to 12 to 18 to 24 months. But with fillers, I tend to tell my patients, and at least the way I treat, is to come in 2 to 3 times a year, because I want to use whatever we do today as it's an investment. These fillers, you know, I'll be honest, yes, they cost money, they're pricey, and we just don't want it to go all the way away and we start over every time. So I'll give you an example. I had a patient that came in recently, and this is wonderful. She was super happy with her last treatment, but it had been about 2 years. And she's like, I loved what you did last time. Well, that's great, except now she's 2 years older and all the filler's gone and we're just starting over. I would have much preferred to have seen her and been able to put even every 6 months, just a little touch here or there, because there's so many areas of the face that we can treat with fillers now. We're not going to treat every square inch every single time. So it's really nice to be able to just kind of look at somebody and go, what's needed in the moment? What do we need to do today? And address that. So I think that's why it really, you know, it's a hard question. People say, how long does it last? Thinking, I only have to come in that long, but you know, the way we treat too, I'm not trying to treat you to full correction every time. I'm trying to make things look better, and I want to make it a natural progression for you too.
Does it hurt?
Great question. So that's a big question. People are getting nervous about what's the pain factor. It's actually, I think I showed you, those needles are super, super tiny, which does help. The cannula can look scary, it can look intimidating. I always like to talk about it with patients, so just so you know what to expect. But honestly, I think it's a kinder, gentler way to treat. You just can't do everything with the cannula and you can't do everything with the needle. They kind of work hand in hand. We do use ice. We have numbing cream that you can put on about 15, 20 minutes before that works wonderfully. And funny thing is we do this tapping thing that my medical assistants do that distracts your brain, but it really does help.
Yes.
Yeah.
Oh, good.
Yeah.
When can we get started?
Yeah, soon. So what we will do with Brenda is when we get started with her in the future, you'll get to see some of Brenda's before and afters. I promise to share. But yeah, so I think that kind of wraps up our cosmetic consult. I'll tell you, if you're curious about what fillers or Botox can do for you, I definitely encourage you to schedule a cosmetic consult. Our consults are $75, but you get it back in a gift certificate that you can use for your future treatments, which is great. What else? Oh, prize. What are you going to win? So for joining us today on our noon Zoom, we are giving away a free cosmetic consult. So you're still going to get the $75 gift certificate. I'll be honest, and I'm sorry, but my consults are really scheduling out. I think I'm into January or February right now. But if you are our winner, I will make a special time just for you, I promise. And you get it for free. You get your $75 gift certificate. And as a special bonus gift, I'm going to give you my favorite Go to the Desert Island product, which is this TNS Advanced Serum. I love this. This contains growth factors. It's one of my favorite products. It retails for $318. That is yours if you are our lucky winner. Or if you want to just get your own, you can go to our Advanced Skincare store and get it for 20% off right now during our Customer Appreciation Week sale. So how do you win? There is a link in the chat, correct? Yep, that they can click on, and you can click on that and enter to win. Or if you don't have the ability to do that or technologically inept like I am, you could go and email us if that's easier, and you will email, I think it's dca.marketing@dermatology-atlanta.com. We should have a little graphic that's going to come up for you. And then in the subject line, you want to put consult me. Or consult me. I don't know. How do you say it? Anyway, you're going to put that in your subject line and you will be entered to win. Don't forget, this is Customer Appreciation Week. You have until October 25th to purchase your 20% off Customer Appreciation gift certificate. These are 20% off face value. They're good all year. You can use them towards products or services. Our advanced online skincare store is also 20% off all the products there, so that's wonderful. That all goes through October 25th. And please join us on October 26th when we're going to have our first trivia day. This is also going to be a big giveaway day. We're going to have lots of prizes. It's going to be lots of fun. We'll have some trivia on some of the things that we've gone over in these noon Zooms, and also just some fun DCA trivia, so make sure you join us on that day too. Thanks so much for being with us. I hope you found this useful. Bye.